Hello, good evening, everyone. Today we are going to discuss about the sports injuries in the elbow and the wrist region. This is Dr. Gopal, right? So we commonly face different type of injuries at the elbow and the wrist region. So let's start with the first condition at the elbow, that is tennis elbow. So it is otherwise known as lateral epicondylitis. So it means there is an inflammation at the lateral epicondyle of the humerus. Apart from that, there is a degenerative tears in the common extensor tendon origin, especially the extensor carpi radialis brevis muscle, which is getting involved in this condition, and there is a pain at the lateral epicondyle. So when you see the mechanism of injury, what are the different type of forces which are acting at the lateral epicondyle? So they have found there are overuse syndrome, right? So when the elbow is used repeatedly for any activities or for any sports, there is a chances of getting this condition that is known as tennis elbow, right? The repeated forceful wrist and the finger movements which may cause this condition, or any activity that involves twisting of the wrist can lead to this condition. And it is also noted in software engineers, right? So those who are working in the computer for the long time, tennis elbow, or you can say this lateral epicondylitis. And also it is a name known as tennis elbow. So the tennis players, they are using the wrist repeatedly for their sports activities. So these conditions may occur also in the tennis players. So these are the different type of issues, right, or mechanisms of tennis elbow. When you see the important risk factors, what are the factors which may predispose to this condition? So those who are obese and those who are doing the repeated movements at the elbow and the wrist, or those who are doing the forceful activities, right? So those who are doing the manual labor, or these are the cases which may predispose to the tennis elbow. When you see the etiology is classified into two types according to their involvement. It is known as extrinsic causes and the intrinsic causes. So, for example, in tennis players, uh, due to the faulty playing techniques, mostly late mechanically poor backhands, right? So, they are using the poor techniques or they are using the poor backhand techniques, which may lead to tennis elbow. Or the persons who are carrying the heavy weights and doing the repeated movements, forceful activities, and manual labor. So these are the causes comes under the extrinsic causes. When you see the intrinsic causes, it may be due to the issues or the problems inside the body. So, for example, if there are any changes in the humerus, or in the problems in the bone, or the problem in the muscles, right? So, due to the anatomical factors, or sometimes it may be due to the changes due to the age-related changes, or sometimes it may be the systemic factors. Hence, the tennis elbow is classified into extrinsic and the intrinsic causes. The extrinsic causes are the factors which from the outside, and the intrinsic causes are factors which is present inside. And when you see a person with tennis elbow, they show some important signs and symptoms. So what are the signs and symptoms? The person usually shows, the person may show that there is a diffuse pain in the lateral aspect of the elbow, and they may express stiffness at the elbow joint during the morning sessions, and they may have occasionally night pain, and sometimes they may have a weak grip strength, hand grip strength, and they cannot be able to hold the objects properly. So there is a chances of dropping of the objects. And when you palpate that region, there is a pain at the lateral epicondyle. And when the person is doing active or resisted extension exercises, there is a pain. Or when the persons are grasping the objects, there is a pain. Or it may be sometimes lifting the heavy objects, or turning the door handles, or brushing the teeth. So in such activities of daily living, the person shows the pain sensations. So when you suspect a person with tennis elbow, there are some few tests, very simple tests, which will be helpful to identify the issues. So the first test is known as Cosen's test. So how it has to be performed? We have to ask the person to do the extension with the resisted for the wrist and elbow in a fully extended manner, so which produce the pain at the lateral aspect of the elbow. So this is the very simple test which will be helpful to identify the tennis elbow. So you can see the figure 1, and in the second figure you can see the name of the test is known as Mills test, in which the elbow held in the extension and passive wrist flexion and pronation produces the pain sensation. So when you press that area, the person has pain, so which may lead a positive sign for the tennis elbow. That there is which will be helpful to identify the problem, that is known as mouth slash test. So in which the examiner resists the extension of the third digit of the hands by means of giving the resistance. So in that time there is a action, there is a pressure or the resistance to the extensor digitorum muscles, and which produce the pain over the lateral epicondyle. So these three tests are the very simple tests which we can easily perform, right? So which may shows if pain at the lateral epicondyle says that the person has tennis elbow. So the Cosen test, Mills test, and mouth slash test are the very simple test, special test, which will be helpful to identify the problem. And what are the important physical tests or the physical examinations for the tennis elbow persons? So the person have a pain or the tenderness at the lateral elbow region, and there is a pain with resisted wrist extension, and also the person has pain during the resisted supination movement, and there is no need of any special blood investigations, or this x-rays also will not needed for such patients because it is a soft tissue injury problem. And if required, we can suggest the person for MRI, which shows the inflammation of the extensor carpi radialis brevis muscles. So there is no need of any blood investigations or x-ray investigations for tennis elbow persons. And what are the conservative management, right? What are the non-surgical treatment for tennis elbow? So first thing, we should ask the person to take the rest, complete rest, withdraw from all the activities and withdraw from the sports activities. So mainly to avoid the activities which will strain on the extensor muscles of the forearm, like wrist extensor movements, right? And take complete rest, and if required, apply the ice packs over the lateral elbow region. And we can prefer some non-steroidal anti-inflammatory drugs and apply ice over that area. And we can provide, for protection and the support purpose, we can provide the tennis elbow belt, right? So it is shown in the figure, right? So this provide the support to the wrist extensor muscles. And come to the physical therapy treatment. So the first is the ultrasound. So the pulse ultrasound can be given, which can be helpful to break up the scar tissues, and which helpful to promote the healing of the soft tissues, and which provides increase the blood flow in the particular region. Next, the deep transverse friction massage. So no benefit when combined with concurrent physical therapy modalities when compared to the control group. So still, at home you can provide these exercises, right? So you can provide this procedure at home as a home instructions. And manipulation of the wrist. So there is a study which shows that scaphoid thrust manipulation will be helpful to improve the tennis elbow. And cervicothoracic spine manipulation. So non-thrust manipulation and retraction of the cervical spine. So lateral cervical glide techniques will be helpful to the condition of tennis elbow. So these are the treatments that comes under the tennis elbow patients. Apart from that, there are some simple exercises which will be advised to the patient to maintain or to prevent or protect from further injuries or further recurrent issues. So we should teach the eccentric exercises to the wrist extensor muscles, and give the stretch for the forearm flexor muscles, and forearm pronation strengthening exercises, and forearm extensor stretch exercises, and squeezing of the ball, and do the simple free movements for the biceps and triceps, drawing the sword, and hammer curls, right? So these are some free activities and free strengthening exercises should be taught to the patient to maintain or to prevent further injuries. And still the person persists to the problem, so the person may be advised for the medical management. So they have been advised to take anti-inflammatory drugs ibuprofen or aspirin for the pain relief and the inflammation. Or in some cases, in the advanced cases, the local steroid injections can be given with lidocaine, with aseptic precautions can be given to reduce the pain and the local inflammations. Or in some cases, platelet-rich plasma, which can be used, their own blood can be used. Or in the chronic stages of tennis elbow, they may be indicated for the surgery. So the types of surgeries available for these conditions are open surgeries and the arthroscopic surgeries. So these are the management for the tennis elbow conditions, right? So this is the brief idea about the tennis elbow persons. And come to the second condition, which is commonly affected in the elbow region, is golfer's elbow. Right, the golfer's elbow is otherwise known as medial epicondylitis. There is an inflammation of the medial epicondyle of the humerus, so that is why it is known as medial epicondylitis. So it is an inflammation, degenerative condition that causes pain by the tendons of the forearm muscles, that is especially the flexor muscles attached to the bony bump on the inside of the elbow. So we all know that in the inner aspect of the elbow, there is, at medial epicondylitis, there is the presence of wrist flexors. So the pain might spread into the forearm and the wrist, right? So after injury, the pain may be spreaded to the forearm and the wrist. So the pain of golfer's elbow can come on suddenly or gradually, right? So the onset of injury may be sudden onset or gradual onsets. The pain might worsen with certain movements such as swinging or golf club, right? So when the person, when especially the golf players, right? So those who are doing swinging the ball, so there is chances of getting this pain. So what are the common causes or the mechanism of the injury for golfer's elbow? So generally it is also known as repeated injury, or you can say it is overuse injury. So it is an overuse syndrome in the following sports, especially in throwing sports, where it may be related to repeated valgus injury, right? So the elbow will be go in an outward direction. So in which the flexor and the pronator muscles are getting involved, and the wrist flexion and the forearm pronations are excessive. So there are few sports which are more prone for this golfer's elbow. So the first one is the golf. So in which there is a excessive driving force, right, which may produce the excessive force on the elbow, which shifting the ground and using the rocket sports due to the wrist action. Or in some cases, like in baseball pitching and in pull throw phase of the swimming, or in some phases of swimming, which may lead these conditions. Occupations that require a strong hand grip and an adduction movement of the elbow also produce such problem, right? It occurs in the middle-aged subjects involved in these activities. So generally, this golfer's elbow occurs in the players who are involving in the golf activities, swimming or baseball pitchers. What are the signs and symptoms, right? So the pain at the medial epicondyle of the humerus, right? So you can find there is a pain in the inner aspect of the elbow, can be associated with ulnar neuropathy. So generally, in the inner aspect of the elbow, the ulnar nerve is very superficial. So if there is any inflammation in the medial epicondyle of the humerus, which compresses the nerve, ulnar nerve, and it produces ulnar neuropathy. And also the person shows there is a slight tenderness in the inner aspect of the elbow. There is a tenderness, and you can find there is a spasm and stiffness of the wrist flexor muscles. Also, on movement of the wrist, right? Whenever the person with golfer's elbow making the movements at the wrist, it produces severe pain, and movement at the elbow also produce excruciating pain. So the pain when shaking the hands also we can suspect, and the person may have the weak grasp, right? So the person cannot be able to grasp the objects, so the hand grip strength will be reduced, and the numbness and tingling from the elbow to the fingers. So pain flexing the wrist, and you can find the numbness and tingling. So these sensations might radiate it into one or more fingers. Usually the radiations where you can find the numbness in the middle and the ring fingers. So how you can diagnose, right? How you can diagnose the golfer's elbow means you can find there is a tenderness on the palpation, which is felt under the medial epicondyle, right? So if you press the medial, just below the medial epicondyle. So the person have the tenderness or pain, right? So this is the first examination. And the pain on the resisted pronation of the forearm, right? So when you give the resistance to the pronation, and if you ask the person to do the pronation, so the person have elicited pain at the medial epicondyle of the humerus. Pain on stretching the flexor muscles, right? When if you stretch the muscles of the wrist flexors, which produced pain at the origin of the wrist flexors. Pain on resisted wrist flexion and ulnar deviation, right? So these are the some of the combined movements which elicits pain and the medial epicondyle of the humerus. So these are the some of the important physical examinations. Apart from that, there are some other investigations, especially the same like tennis elbow. X-ray is not helpful to identify the golfer's elbow. If you suspect still the person has issues in the medial epicondyle, we can suggest the person for MRI. So the MRI scan of the elbow can detect the inflammation and shear of the common flexor of the forearm. So the thickening and increased signal intensity on both T1 and T2 weighted sequence of the common flexor tendon, soft tissue injuries are, so then also you can see the edema around the common flexor tendon. So especially in cases of soft tissue injuries, we can prescribe with the MRI scan than the X-ray. So when you come to the treatment, when you see the conservative management, so the non-surgical treatment, so we can be the patients who are suffering with golfer's elbow will be prescribed with some medicines like analgesics, antacids, multivitamin tablets, and they will be prescribed with some local ointments like analgesic ointments. And they also be preferred for physical therapy treatment. So they will be treated with rest and applying some types of bases and splints. And still it is not healed, maybe referred for some type of injections, hydrocortisone injections, steroidal injections, and physical therapy. Right. So these are the some of the conservative or golfer's elbow. Still, the patient persists with such type of signs and symptoms, or if the patient is in the stage of chronic, they may be indicated for the surgical treatment. So here there is a stitching and tightening of the ligaments and tendon removal of the osteophytes from the medial epicondyle, which causes the pain. So according to the involvement, right, according to the pathology, they may be go for the surgeries, right? So the surgical treatment will be done for such patients. So when you specifically, if you see the physical therapy management for golfer's elbow, first thing should be started with ultrasonic treatments. So you can, I have given the parameters, right? So the ultrasonic treatment will be given in a pulsed mode or in a continuous mode according to the stage. And apply the ice massage over that region. And laser therapy can be given to the particular area, or some type of shock wave therapy, exponential shock wave therapy can be given for the elbow region. Apart from these electrical modalities, the patient may be treated with some type of exercises, strengthening exercises with resistance. And we should ask the patient to change the lifestyle, right? So change the lifestyle, and patient prescribe the elbow region. These are the physical therapy for the patients who are suffering with golfer's elbow. So the main very important thing is to change the lifestyle. So if the person is taking some type of any type of repeated activities or overuse syndromes, so it should be given with some type of rest or some alternative movements. So still there are very few exercises which will be helpful for the golfer's elbow conditions. Wrist range of motion exercises, that is wrist flexion and extension, and also pronation and supination at the and inferior elbow range of motion like flexion and and free activities and free exercises to the patients, right? So these are the some of the important exercises which can be treated as a home treatment for the patients suffering with golfer's elbow. So there is a difference between tennis elbow and the golfer's elbow. So the tennis elbow means the problem or the issues in the lateral epicondyle of the humerus, and the golfer's elbow means the issues and the medial epicondyle of the humerus. Then when you come to the wrist joint, the name of the name of the issue or the problem commonly you can see is carpal tunnel syndrome. So the carpal tunnel syndrome means the most common focal peripheral neuropathy which results from the compression of the median nerve at the wrist. So you can see the normal anatomy at the wrist region. There is a flexor retinaculum and the carpal bones which makes a tunnel. So if there is any changes or if there are any issues in the normal anatomy or in the normal structure of this region which will produce the compression of the median nerve. So which may be affect any type of people, all type of people within any age, and generally the women are affected more than men. So the persons who are using the tools, especially the hand tools or tools that vibrate, which may produce these issues. Or in some sports like the baseball or the handball, which produce such type of problem, or in some cases of playing some musical instruments, also produce these issues or this injury. So what are the common causes? This we have already discussed. In cases of any abnormality or anomalies in the flexor tendons, or the flexor retinaculum, or if there is a changes in the carpal tunnel or in the carpal canal, so congenitally small carpal canal, or there is a presence of any type of tumors at the wrist region, that is ganglion cyst, or inflammation of the flexor tendons, right, flexor tenosynovitis, or in some cases of connective tissue diseases or connective tissue disorders, or gout or pseudo gout, or in cases of rheumatoid arthritis, pregnancy, obesity, edema, and congestive heart failure, right? So these are some of the causes for the carpal tunnel syndrome, right? So whenever you feel if there is any compression of the median nerve at the carpal tunnel, is known as carpal tunnel syndrome. When you suspect a person with carpal tunnel syndrome, they may show some important features, right? So they may have pain at the wrist, and there is a numbness in the hand region, right? So you can find there is a numbness in the hand region, right? So which are the median nerve which is applying to this area, and they have tingling sensations over the area which is supplied by the median nerve, and the symptoms are usually worse at night and can awaken patients from the sleep. To relieve from the symptoms, patient often flick their wrist as if they're shaking during a thermometer, right? So this is known as flick sign, right? So whenever if they shake their hands or if they flick their hands, the pain will be subsided, right? So this is the one of the relieving method the persons who are suffering with carpal tunnel pain. So there are two very simple tests which will be helpful to identify the problem of carpal tunnel syndrome. So the first one is known as balance test. So you can see the picture. What we have to do, in which the patient is asked to do the 90-degree of wrist flexion, right, for a period of 1 minute. So the patient is then asked for the complaints of tingling, numbness, or pain in the first three fingers, right? So you can find there is a, because these regions are supplied by the median nerve. So this is the first test which will be helpful to identify the issues of carpal tunnel syndrome. Or the next test is known as tunnel sign. So in which just press or compress the carpal tunnel for a minute, which produce the same sensation and same issues, right? So tape over the median nerve as it passes through the carpal tunnel. So which produce the same signs and symptoms, which will be helpful to identify the issues, right? So the phalanx test and the tunnel sign are the two important special tests will be helpful to identify the problems of carpal tunnel syndrome. So how the persons can be treated, right? What are the management or medical management for the carpal tunnel syndrome? So you have to take the general measures. What are the causes, right? So try to identify the exact cause for the carpal tunnel syndrome. So the treatment should be problem oriented, and apply the splints, right? So you can see the picture, right? So which gives the supports to the wrist region, right? So the further compression of the median nerve will be prevented with the help of special type custom made splints. And still the person's the cause is due to any inflammations or edema, so the person may be prescribed with some type of medications, right, oral medications, or in some cases in severe of carpal tunnel syndrome, there is a possibility of local injections, hydrocortisone injections are available, or in physical therapy there is a application of the ultrasound, right, which produce the pain sensation and which can be helpful to reduce the inflammation around the wrist region. So these are the common conservative management for the carpal tunnel syndrome. Apart from that, there are very few exercises which will be helpful to reduce the pain and improve the condition. So wrist flexion and extension exercises, and ulnar deviation and the radial deviation. And you can go for the stretching for the wrist flexors and wrist extensors, right? Stretching of the muscles and wrist flexion stretch. And you can provide the pronation and supination exercises, and squeezing of the hand means squeezing with the ball, soft ball or the medicine ball, right? So these are the some of the exercises, small hand exercises which will be helpful to improve the conditions in a positive manner. So these are the exercises which can be taught to the patients. Next to carpal tunnel syndrome, the most problem which is occurs in the hand region is de Quervain's disease. So the de Quervain's disease is a stenosing tenosynovitis of the first dorsal compartment of the wrist, which contains two very important muscles, abductor pollicis and extensor pollicis brevis. And it is also characterized by degeneration and fibrosis of the tendon sheath. So we can see most often in the individuals the age between 30 and 50 years. So when you see the gender, right? So the women are up to 6 times more often than men, right? So it commonly noted in the dominant hand, means the person who are using the hand which is acting more. And when you see the important causes of this de Quervain's disease, it is secondary to repetitive or sustained tension on the tendons of the first dorsal compartment. Apart from that, it may be due to some trauma or increased frictional forces between the tendons, or in some cases anatomical variations, right? So if there is any anomalies in the bone structures or in the tendons or the ligaments, or it may be due to the biomechanical compressions or poor mechanisms, or it is also noted in some cases of repeated microtrauma and in some cases of inflammatory diseases, and increased volume states such as during the pregnancy. So during pregnancy, there is a chances of inflammations and edema in the hand regions. So when you see the signs and symptoms of this de Quervain's disease, so localized pain along the radial side of the wrist. That means in the lateral side of the wrist, the person may be having the pain. You can see the picture, the lateral side of the hand and in the wrist and in the thumb, the person shows the pain. And generally, the onset of pain is gradual in onset. When you are trying to grab some objects, heavy objects, the pain may be aggravated, right, with the wrist in the neutral rotation. And there is a chances of localized swelling may be seen. You can see there is a swelling in the localized region around the wrist and in the tendon region. And if you compress that area, right, if you palpate that area, there is a tenderness along the radius styloid process. So there is an important test which will be helpful to identify this de Quervain's disease, is the Finkelstein test. So how you have to do this test? Just ask the person to make a fist and keep the thumb inside the fist and try to do the ulnar deviation, right, which produce the excruciating pain in the lateral styloid, means especially in the radial styloid process. So this shows the positive de Quervain's disease. So when you come to the treatment, non-surgical treatment for de Quervain's disease, the non-surgical treatment should be the first course of action for de Quervain's disease, and generally the patient presenting with mild to moderate pain that does not limit the activities of daily living may be treated with rest, right? Always, this is a very important step that, if you find with any persons with any type of soft tissue injuries, so we'll start with the rest. And to prevent the further injuries and to protect the structures, we need to apply some braces of the splints. And if necessary, if the person is suffered with pain or inflammation, you can go with the non-steroidal anti-inflammatory drugs or corticosteroid injections. But still, the person or the patient persists of pain or in the stage of chronic, you can be treated with the surgical procedures. So the retinaculum of the first dorsal compartment is completely incised within line with the and abductor pollicis longus and extensor pollicis brevis tendons. So when you come to the physical therapy treatment, so what are the important treatment in the line of treatment? So first you should apply with the cold for 12 minutes over the inflamed area, and you can go with the ultrasound treatment. It's either if it is in the acute stage, you can go with the pulse mode 3 megahertz, and the duration is for by about 5 minutes. And the chlorophoresis is a type of treatment with the help of ultrasound, right? So you are applying some drugs, that is especially the hydrocortisone drugs are applied through the ultrasound. This procedure is known as chronophorosis. Apart from that, we have to give some active and passive motions of the thumb and wrist, engaged for 5 minutes every hour. Along with that, how to teach some important strengthening and stretching exercise for reducing pain and to improve the range of motion and to get the strength of the muscles. So along with that, these are some of the exercises, common exercises, which can be given as a home treatment for the patients. So you can ask the patient to do some opposition movements, wrist flexion, 3 movements of the wrist flexion and extension, and also squeezing the ball and finger movements, all the movements, right? So you can teach, so you can give the pamphlets regarding these exercises right? So it will be more effective for the patients. And finally, I thank you all for this present